Wherever, anywhere, wherever. There's nothing specific.
This is Dr. Morgan, so he's going to get started with his presentation in just a moment.
All right, hello everyone.
Hello.
Now, I had a little trouble navigating around the school here since it's changed, so my apologies. But the school is beautiful. All right, so as she just said, my name is Dr. Morgan. I'm the owner and founder of ACMS, American Chiropractic Medical Services. We're located on Chartier Road, right next door to the Lumberjack. Okay, so I'll give you a little bit about my history. She was kind of working me a little bit already. Back in 2012, I came out of graduate school. I opened up a clinic over in Port Huron. I started working immediately with the high school up there, Port Huron Northern. I was working with the football team, the wrestling team, basketball team. Then I opened up a second clinic here in Marine City, the one over by Lumberjack. And I came over here, I started working with the high school here, football team, basketball team, volleyball team. My wife, she got pregnant with our twin daughters, so she was like, you gotta pick, you're doing too much stuff out of the house, I need help here with these kids. So I sold the Port Huron clinic, and then I focused right here. And I was still able to help the school until 2016. We had our third daughter, our surprise daughter. It's like 18 months later. She's like, hey, I'm pregnant. So we had this other kid. And she's like, now you can't do any of that stuff anymore. I need you here with these three kids. 2018, we had my son. He was our last hurrah. And then now he's 6 years old in the first grade. I have the opportunity to get out in the community and get back again. So that's why I'm back here now. So we always try to help individual students and groups and teams like that are kind of the ones that get overlooked. They're not talked about on the announcements all the time. You know, football, right? So we try to focus on the other teams that don't quite get all that shine, right? We all are athletes right here, so we want our bodies to perform and maintain, okay? We don't want to prematurely break down. We want to catch injuries before they happen. And so that's why I'm here today, to talk about prevention versus responding to when the injury is already taken place. Now you guys are long distance runners, so there's a lot of biomechanics that go involved with that, from the toe off, to flat foot, to midfoot, to the heel strike, and then the way that you carry your trunk, okay? So we're gonna do an assessment today, so I do need 3 volunteers. Can I have 3 volunteers? We got one, what's your name, sir? Ron, come on over here, Ron. Volunteer, all right, come on up. I need one more person. One more brave.
Be your volunteer.
All right, so what we're gonna do is we're going to do a squat. So this is a functional assessment of the squat. So when we perform the squat, I know you guys wonder if I was coming here to do the plumbing, right? So with this here, we should be able to do a dynamic movement. So we should be able to have the pole over our head, should be able to touch our head, we should be able to stand shoulder width apart, go straight down to squat, be able to touch the pole to our head and have our arms straight, and then come back up. It should be nice and slow, it should be deep, they call it A to G, y'all can figure that out. So we'll go with this gentleman here first. So pole straight over your head, look straight up, and then maybe touch your head there. Okay, so that's where you want it to be when you're down in that squat. Go ahead and do what you can. Bring it back up, and then go ahead and do the squat. Okay, all right. So one thing we see with that squat, we want dorsiflexion of the knees, extension of the hips, and then extension of the upper back. So you see how the back should be straight up and down, right? So let's give him a hand. So that lets us know that we have some restrictions and tightness though, mostly in the lower back, if y'all notice that, and then when his arms came down too, so it might be some shoulder involvement. So just from that one movement, we can identify these biomechanical faults that already exist that are not giving us problems now, but could in the future. So we want to be more preventative than reactive. Go ahead and do yours. Come on back up. All right. So we looked at a lot of dorsiflexion here, right? So at the bottom of that squat, we should have our feet completely flat on the floor. We should have to go up on our tippy toes. So just a little bit right here. Now imagine how that affects stride and gait, right? So let's give her a hand. All right. Here we go. Yeah, should be able to touch it. There we go. All right. Okay. All right, come on back up. Good job. So I got a little something for you 3 brave people here. Here we go. So this is ice pack, hot pack. Ice pack, hot pack, ice pack, hot pack. another guess. We'll get one to one. Ice pack. There we go. All right. So, with that biomechanical assessment, we can identify things before they happen. So, right, we don't want to have our knee hurt and we end up at the orthopedist getting injections and shots like that. We're not even 20 years old, right? So, we don't want to go down that route if we can prevent it. So, the thing that I brought in here too is for every athlete in the room. Now, I was told it'd be like 10 people here and some parents. I printed off 15 of these, so I'm gonna have you grab one and just pass it to the athletes here. We'll have something special for the families too. Now, if you look at that, that is a digital foot scan. Now, with our digital foot scan, we can see the arches in our feet. Everyone has 3 arches in their feet. Usually the first arch breaks down, so we need some type of pelvic stabilizer, right? Then you see the next thing that's still in there. This one here, we can identify. The second one on here is we can look at knee flexion and extension. We take sensors and we put them on the side of your legs, and then we can lump your results into a cohort study that is your age and specific demographics to see where you are on that range, the high end, the low end, as far as flexibility, okay? Then we go down to the next one right here, we can identify low backs. So we put sensors on your lower back, and we have you go through basic range of motion, flexion, extension, side to side, okay? And then we, again, compare that to the normal cohort of your group. And here you see we go down, and we do the same thing with a posture screen. Now there's a thing that's called crooked man and crooked woman. Those are the normal imbalances that we have in our body. But if we have a foot that's turned in, that's putting additional pressure on the medial part of the knee, and then over to the shoulder and along to the waist. So when we start to correct those things like that, we can prevent injuries from happening. So it's kind of like looking in the crystal ball of your body, right? So here we get all those baselines, and once we have those baselines, if anything ever changes with you, I stubbed my toe, I hurt my shoulder, we get you back to that baseline, okay? So we're doing this in our office here for the next 2 weeks, complimentary for you guys, okay? You just call that number, we'll get you signed up, all right? Any questions on that? Okay, so as far as parents go, we're gonna invite you in for a complimentary laser session. Now, with the laser session, if you got knee pain, elbow pain, anything like that, we'll do a comp service so you can get a sample of what that treatment would be like. It's safe, it's non-invasive, doesn't require any drugs or surgery, and is usually over in a few months. And then you're happy, feel better after. All right, so any questions there that anyone has? No questions? I'm usually here talking and answering questions for about 20 minutes after. I guess I did it really good. Who is the money person? Because I got a donation to make for you guys. Who do I get a check to?
You can.
All right. Okay, so again, get scheduled over the next 2 weeks for this right here. I think you guys will be interested to see how your results are and how they compare to your normal cohort. In addition to that, if you read the sheet, we'll give you some stuff to make you Iron Man or Iron Woman, right? We'll bulletproof your knees, bulletproof your back. Everything takes time though, so understand it's a process, it's not a microwave, okay? It's a process always happens. All right, so if there's no questions, I'll end with that. I won't bore you anymore with my stuff, but come on in and we'll get you taken care of as best we can, okay?
Thank you.
All right, thank you very much.